Good morning, everybody. Today we are going to see about the second part of the heart development. So before we going, we'll just see about a case. This is a 24-year-old man who presented to the outpatient clinic for health and children checkup. The intern, while examining, could hear a fixed split of S2. S2 is the second heart sound, and there was a mild ejection systolic murmur. So what could the reason be? So this is a case of atrial septal defect. So in today's session, about the development of the sinus venosus, the atria, and the clinical correlates. The sinus venosus, the lowermost part of the heart loop, has got a right horn and a left horn. And from each horn, there is a vitelline vein, an umbilical vein, and a common cardinal vein. So the right horn has got a vitelline vein, umbilical and cardinal vein, and the left horn has got a vitelline, umbilical, and a common. So the right margin of the sinoatrial orifice. So that's the one which forms the crista. So this is another picture. Here we are seeing the sinoatrial sinus venous is getting opening into the primitive atrium, and the three veins, the common cardinal, the vitelline, and the umbilical veins of the both right and left. And here you can see the left side is getting regressed when forming the coronary sinus, and the right-sided vitelline vein forming the inferior vena cava, the common cardinal vein forming the superior vena cava. And this is the final part. So where the left horn of the sinus venosus becomes the coronary sinus, and the right horn forms a small portion of the right atrium, as well as the superior vena cava and the inferior vena cava. See this once again. The sinoatrial orifice, the right and the left venous valves, and it's connected above by the septum sporium. There is a septum which forms approximately in the middle, so that's septum primum. The septum primum moves towards the endocardial cushion bud, and once it touches the endocardial cushion bud, there is another septum which forms medially, and that's the septum secundum. And there is an ostium secundum which is found above. So initially the ostium primum, until this septum primum gets attached to the endocardial cushion bud, and once it touches this, the ostium primum disappears and the ostium secundum is formed near the upper part, near the roof of the heart, and the septum secundum starts to develop, but it's in septum, the interatrial septum. Initially, there is a communication, there is a shunt when the baby is inside the mother, so that's in the fetal circulation. So the septum primum gives way, so the ostium secundum will be open, and the blood is shunted through this into the left atrium. It bypasses it, okay, and then it goes, because it's already oxygenated. What happens after birth? The left atrial pressure is raised, and as a result, the shunt is closed, okay, and the floor of the septum primum forms the fossa vallis. So here also you can see the dorsal mesocardium, which is approximately in the middle, and this is the septum primum, and the dorsal mesenchymal protrusion, which is coming from the dorsal mesocardium, extends along with it. Okay, it is said, it's been recently found out that this dorsal mesocardium is protrusion, mesenchymal protrusion, is helping to form, is the place where the pulmonary veins are formed. Okay, so this dorsal mesenchymal protrusion is the place where the pulmonary veins gets opened into. Okay, so this determines where the pulmonary veins get opened. The pulmonary veins is the one which comes from the lungs, the one which carries the oxygenated blood from the lungs, okay, once after birth. So here the dorsal mesenchymal protrusion, it extends down along with the septum primum, and it also helps in forming the atrioventricular orifice, the atrioventricular septum near the endocardial cushion bed. Apart from the endocardial cushion bed, the dorsal mesenchymal protrusion also helps in the formation of the atrioventricular septum. Okay, so the dorsal mesenchymal protrusion. So inside the dorsal mesenchymal protrusion is the place where the pulmonary veins opened into. Now this pulmonary veins, initially there is one vein, but because of resorption, as the vein is getting resorbed, the pulmonary veins, they get resorbed and they help in the formation of the left atrium. They help in the formation of the left atrium. So here, finally, we are seeing the right and left venous valves, the sinoatrial orifice, the septum spurium, the septum primum, okay, and this the dorsal mesenchymal protrusion. So through this dorsal mesenchymal protrusion is the one where the pulmonary veins open. Now this dorsal mesenchymal protrusion is very important because this is the one which determines where the pulmonary vein should open into. The pulmonary vein should not open into the right atrium. Okay, so the dorsal mesenchymal protrusion helps in determining where the pulmonary veins needs to open into the left atrium. Okay, so that after birth, all the oxygenated blood comes through the pulmonary veins into the left atrium. Okay, so as this vein is getting resolved, okay, so that forms the whole of the left atrium. Okay, the whole of the left atrium. Okay, and here you can see the sinus venosus, the right valve, the right venous valve, and the left venous valve, the right and the left venous valves. So here you can see the right venous valve forming the crista terminalis. You know that the right atrium has got a rough part and a smooth part. Okay, so the rough part is the one which develops from the primitive atrium. The smooth part is the one which develops from the sinus venosus. Okay, the smooth part is the one which develops from sinus venosus, and the rough part is the one which develops from the primitive atrium. At the junction between these two, the right venous valve, that's the one which forms the crista terminalis. Okay, that's the one which forms the crista terminalis. And the lower portion of this right venous valve also helps in forming the valves of the inferior vena cava and the coronary sinus. Okay, the valves of the inferior vena cava and the coronary sinus. And here you can see the pulmonary vein is getting resorbed to form the major portion of the left atrium. So most of the left atrium is smooth, as we have seen, because of the absorption of the left atrium, or because of the absorption of the pulmonary veins. The pulmonary veins gets resorbed, and as a result they form the major portion of the. To conclude or to summarize, the right atrium, the main part is developed from the primitive atrium, which is rough, and the smooth part is developed from sinus venosus. A small portion also develops from the right half of the atrioventricular. So here you could see the smooth portion, which is developed from sinus venosus, the rough part, which is from the primitive atrium, and a small portion from the right half of the atrioventricular orifice. Okay, coming to the left atrium, the rough portion is the one which forms the left auricle, the primitive atrium, the left half of the atrioventricular canal, and the major portion is by the absorption of the pulmonary. So here you can see, initially you can see the left atrium is also rough, Okay, this is the pulmonary vein. Because of the absorption, the single primary, the primordial pulmonary vein, is getting absorbed and absorbed into the wall, and then it forms the walls of the. With this, we come to the end of the atrial septum and the development of the sinus venosus. Right? If you have any doubts, you are welcome to email me, or you can just comment on this YouTube video. Okay, thank you so much. And these are the your advice to read about the Langman's medical embryology or the Kidmore development, whichever is easier for you. Right? Thank you.